Okay, hey everybody, it's Dr. Khadisha, your board certified emergency medicine physician and author of the best-selling book, Help Us Help You in the Emergency Room, also creator of the Mobile MD Kit. Learn about both of those on my website at www.drkhadishamd. But today we are here to discuss how the hospitals are helping to keep us safe during this pandemic. You know, I work in an ER. I work in primarily in a freestanding ER, a local freestanding ER, and it's been surprisingly slow at times. And I think you've probably heard that nationwide, if you're not in a hot spot, sometimes the hospitals can be seeing a less volume than they typically do see. And that could be why some doctors are being furloughed and some folks are being laid off in those areas that are not hot spots. And I'm seeing and I'm hearing directly from patients that they're afraid to go to the hospital. They're afraid of catching the coronavirus. And I've seen people who've had falls. I've seen people who've had anxiety attacks, chest pain, things like that. I had a patient who had a severe kidney stone pain. And she said that last time I had pain like this, I needed to go to the hospital, but I'm not going this time. She flat out told me before anything was done, before we found out, I'm just maybe hooking up a little light here, before we found out the size of her kidney stone, what her kidney function was, all of those things, she said that she was not going to the hospital. I had a patient who fell in a local bank, and she said that the bank called the paramedics, and she told the paramedics, don't get too close. Don't come too close to me. I don't want to catch the coronavirus. She told me that she told them that she declined transport to the hospital, and she was over 60. So that was another reason why she was afraid of catching the coronavirus. And she was also afraid that they weren't keeping, that she might catch the coronavirus from the ambulance. So she chose to drive herself in pain to my facility. Okay, so out of fear. She could have been transferred to the hospital by ambulance, but chose to drive herself. Okay, so folks, if you could please, hit like, press share, because this is really important information, and I hope that it helps. It helps, if not you, your family, friends, coworkers, because I'm hearing that this is a nationwide issue of people not getting the care that they might sometimes really need out of fear of catching the coronavirus in the hospital. And I'm not saying that the concern is not real. There have been studies that have shown a significant percentage of people catching the infection, becoming infected at doctor's appointments and in the hospital and things like that. But that was earlier on, before hospitals began to take more measures of protection. Okay, so yes, it's gotten a little bit lengthy. I thought it would just be a few things, but the hospitals are really doing a lot. So number one, here's some advice for you. Call the medical facility of your choice before arrival to prepare the medical staff so that they can prepare for you. And it's really good to call them and let them know, because it's not just a matter of you telling them that you're coming, but they may have some questions to ask you so that they know where best to direct you once you arrive. And it might not just be that. They might also want to do some phone triage, or they may want to provide an option of telemedicine where you may be able to see a physician and have your issue tended to before without even arriving. Oh, I think I got a hello from Australia. Okay, so let's see. So I have an assistant with me today, and yeah, if you want to jump on a call and discuss things that you're seeing or discuss your concerns, I think we're able to do that today. Okay, so yeah, just let us know. Okay, so number one, and folks, do note this in your comments, just so that folks who look at this later might be able to see the tips or highlights. So number one, call before you go, if that is at all possible. That way the staff knows you're coming, there's no surprises, and they might be able to do some things for you that help keep you out of the doctor's office or the hospital altogether. So they may triage you to find out what your symptoms are, what your history is, and to see if you are a part of that vulnerable population that may have a more complicated course of recovery from a COVID infection. Okay, and the CDC has guided this. The CDC has provided phone scripts for medical staff, and down to the greeting. They've provided information for medical staff speaking with patients over the phone. So and there's like a triage, there's an evaluation like algorithm, and a list of life-threatening conditions that they may want to see if you have or not, so they know whether or not you should come or whether or not you should call 911 and go by ambulance. So some things are going to ask you, are you having, because it's screening too, so it's screening and triage. So the screening is less detailed than triage. So the screening might be them asking if you have fever, cough, or shortness of breath. But mind you, there are, I think they're saying in the news now that, they're definitely saying in the news that there are 6 new symptoms that they've added that might be concerning for COVID-19. And I will tell you, as a physician with 20 years experience, that all of these symptoms can be seen with a multitude of viruses. And believe it or not, there are coronaviruses that are always around, but that just aren't this strain of virus. So fever, cough, shortness of breath, the 6 new symptoms: chills, repeated chills with shakes. So that's 2 separate chills, repeated chills with shakes, muscle aches, headaches, the loss of the sense of taste or smell, and sore throat. So, we all had gotten the fever, cough, shortness of breath down, but now it's headaches, sore throat, chills with shakes, in addition to the loss of sense of taste or smell. So they'll go through that. And so then they might continue the screening, but for underlying medical conditions, those underlying medical conditions that we expect to hear whenever we hear of a death from COVID. So underlying medical conditions due to chronic lung disease, such as asthma or chronic obstructive pulmonary disease, which includes like emphysema, chronic bronchitis, and asthma typically tends to be part of that trio. But, simple asthmatics are of concern, and folks with chronic obstructive pulmonary disease, usually from decades of smoking or possibly being the spouse of a smoker. You might be at risk for COPD also. Serious heart conditions like congestive heart failure, because that also can compromise one's ability to breathe. It also can cause the lungs to accumulate fluid, just like COVID can, by way of ARDS, acute respiratory distress syndrome. Another condition, complicated diabetes, being diabetes that isn't controlled, that has led to amputations, loss of vision, chronic kidney disease, bouts of uncontrolled diabetes where the blood sugar is sky high, or you've developed something called diabetic ketoacidosis, otherwise known as DKA, when diabetes is out of control. Another thing they might ask for are neurological conditions that compromise the ability to cough and clear the lungs and respiratory tract, such as spinal cord injury due to trauma. Also strokes, cerebral palsy, severe developmental delay, things like that. Another underlying condition is weakened immune system. So people who are transplant patients, people with HIV, people on any kind of immunosuppressant are considered part of that vulnerable population. People on dialysis, they might ask you about that as well. Cirrhosis of the liver, they may ask you about that as well. Extreme obesity, that was also discussed today, as extreme obesity can lead to difficulty breathing. And, I'll let you know something, from as a physician, we are told, we're taught, we take courses on how to manage a difficult airway, meaning, if someone has trouble breathing, or if we need to put them on life support by way of intubating them, meaning we put the breathing tube into your trachea and connect you to life support, meaning the ventilator. All those ventilators that people are talking about, that's what life support is typically referring to, being on a ventilator. And if someone is extremely obese, while you may see extra tissue on the outside, redundant tissue on the outside, there is also internal extra redundant heavy tissue that sometimes makes it hard for us to see the windpipe or to move around certain structures in the pharyngeal area or in the throat area, so that we can get the tube where it needs to go in the windpipe. So extreme obesity is also an underlying condition. And then we also like to know before you come if you are pregnant. So that's just one thing that hospitals do to make it safe for people to continue to get care. They have you call ahead. They triage you, screen you, see if you have the common symptoms for COVID, and triage you to see if you have any of those underlying conditions that make you more vulnerable. That's just number one. Number two is personal protective equipment, mainly for the staff, but they also have typically surgical masks should you have any of these respiratory symptoms concerning for COVID, or even before COVID started, when flu was the main thing or pneumonia was the main thing, but more so flu, we always had masks to give you on your arrival if you had fever, cough, anything like that, to protect the staff so that they don't pass it on to other patients. And if you come with family members, to maybe protect your family members if they haven't gotten whatever it is you have already. So personal protective equipment, and training of the staff, in how to put on, gowns, masks, gloves, things like that, to protect themselves, and so that they don't pass on something from the previous patient onto you. So it is to protect you. It looks like it's all about protecting us, but we are also protecting you. We most likely had to don that equipment for the previous patient so that we wouldn't give it to you. Okay, staff are also trained as far as keeping them abreast of the latest updates and recommendations for testing, treatment, so that they know what to tell you should you call with any questions. Public health reporting, how do we let the various health agencies know of cases. The staff is trained in transporting patients, and the office also, or facility, hospital, will also develop a relationship with local and state health departments so that they know the proper way to do testing and the proper way to transport samples to the state and local health departments so that cases are more accurately reported. So that's number 3. That's just number 3, training the staff how to put on equipment and how to communicate information to you and communicate information to the local state and local health departments. So number 3. Okay, so now you've finally arrived at the hospital, your primary care doctor's office, or a freestanding ER. There might be a separate entrance, and because you called ahead, they'll know to direct you to that entrance, or they might even tell you to go to that particular entrance. There might be like an ancillary building, so like an old building that hasn't been used before. Now it's being used as a respiratory virus evaluation center, or there might be a tent just outside of the entrance for people to be triaged further and possibly evaluated, maybe even tested. I know of places that might do testing for their patients for COVID. And that's another thing. If you call ahead and you say that you just want to test, you might not even need to go to the doctor's office. There might be like a city sponsored testing station that you're supposed to go to instead. Okay, so that's your arrival. You might be at a special building, or they might have a tented area for you to go to for respiratory virus evaluation. Okay, so all right, so you've been triaged, you've been screened, maybe you've been tested also. The hospital staff, office staff has also been trained in no-touch methods of disposal of waste containing respiratory secretions. And typically we kind of do that anyway. We're not typically touching respiratory waste anyway. Again, the staff is going to have on masks, gloves, depending on your symptoms and your history and things like that. So no touch methods of waste disposal. And typically we dispose of all waste with gloves on. So that's number 5. And so 6, you're still at the facility, you've been seen and evaluated, be it outside, or maybe you've made it into the facility, into the hospital, the ER, the freestanding ER, your primary care physician's office. After you leave, and so consider the person who left before you, you've been protected by the hospital staff by routine cleaning and disinfection procedures. And there is a difference between cleaning, sanitizing, and disinfecting that are appropriate for COVID-19. And this is done in the exam rooms, any patient care areas, especially ones where aerosol generating procedures were performed. And because under certain circumstances, while the virus is spread through respiratory droplet secretion, it might be aerosolized, say if like an asthmatic patient came and they were in so much respiratory distress that we had to give them a nebulizer treatment. And anyone who's received a nebulizer treatment, you know that it's a mist of the albuterol that's typically in the pump. It's spread out, and that virus may be dispersed among the mist in the aerosol from the nebulizer treatments. And actually, I was told once that If we have patients with asthma and, if, we have to give them a nebulizer treatment, or they have COVID and we have to provide a nebulizer treatment, we are to show the patient the knob on the wall to turn. We leave the room, and then the patient turns the knob to start their treatment, because we should not be in the room at all once that aerosol starts flying. So that's another step that hospital staff is taking to keep you safe, so that you can continue to get the care that you need during this pandemic. So that's another thing. Okay, so let's see. So now we're on to number 7. So I'll recap it. So just in case folks came in late. So number 1, the patient should call before arrival, because not only can the staff prepare for you, but they may also direct you to a more appropriate location. Or they might tell you you can stay home and be treated via telemedicine, or worst case scenario, they tell you to call 911 and go straight to the hospital or the ER if you're just trying to get to your primary care doctor's office. So there's a number of reasons to call before going. So that's number 1. Number 2 is the hospital protects you and the staff with personal protective equipment. If you have symptoms that are concerning, you'll be given a surgical mask. The staff should have anything from a surgical mask to the N95s, goggles, isolation gowns, head covers, things like that, to protect themselves and to protect you and keep from spreading any infection amongst patients. And also in number 2, the staff is updated on testing procedures and the latest updates and things like that. Number 3, separate entrances. The medical facility might have a separate entrance for people with symptoms concerning for COVID, so that folks who aren't of concern can safely enter at another location. Number 4, there may be a designated area for people with respiratory viral symptoms to go instead of even entering the facility. It might be an ancillary building or a tented area. Number 5, there's no touch methods of waste disposal. Okay, and we do that anyway. We're not touching waste with our bare hands. We do. This is the norm. So, you don't have to worry about that. We always do that. Okay, so let me see. That's number 5. Okay, so number 6 is routine cleaning and disinfecting of patient treatment areas, using procedures that are appropriate for cleaning and disinfecting, freeing the area of COVID-19. Okay. So number 7 is that we've stopped elective surgeries. Elective procedures may not be done at that hospital in order to decrease the number of people that are in any given area at any given time. Since surgeries that can wait are waiting. Okay, because some of these surgeries might require that a person be put on a ventilator, on life support. So, because if say the light sedation takes a turn, they might end up on a vent. So no elective surgeries are done. There's fewer people at the hospital. More social distancing is possible. Okay, so that's number 7. Number 8 is limiting the number of visitors. Now, where I work, it takes people off to, when they find out that they have to sit in the car outside, they can't even sit in the lobby if they bring their family, friend, coworker, or loved one to certain facilities, including freestanding ERs like there are in Texas and Colorado and Rhode Island and maybe some other new states. So during this pandemic, expect to possibly have to sit in the car while your loved one is treated inside. That way you are completely protected. You're not going anywhere near that facility if you don't have to go. Okay, so that's number 8. Number 9 is hand sanitizer. There was a study done showing that while having hand sanitizers at the exam room doorways is good, and having hand sanitizer by the faucets is even better, but I don't think it's so great to have it by the faucets, because then it makes you think that it's as good as washing your hands with soap and water, and nothing's better than washing your hands with soap and water for COVID-19. But they're also saying that hand sanitizer should be by the patient's bed so that the staff is less likely to touch anything before getting to the faucet or before leaving the room. Say they're tending to a patient and they have to rush to the next room. This way they can, touch the sanitizer, run their hand, wave their hand under the sanitizer dispenser, and the sanitizer is dispensed in a no-touch fashion, and they can rub their hands, on the way to the faucet, or, God forbid they have to leave the room that quickly, but on their way out the room, at least they've already sanitized their hands if the sanitizer dispenser is right by the patient bed. So that's another thing. So that's number 9. Number 10 is bumping up the ventilation rates to bring in more fresh air from outside, diluting the concentration of virus in the indoor air. So, we're worried about that, that circulating air, is it fresh? Is it, how often is fresh air from outside getting into these facilities? Some facilities are increasing the ventilation rate, so there is more fresh air going in and out, and there is less virus in the air, if there is any in the air. And number 11 is an experimental thing. It might be on the horizon, but the Washington Post reported that the director of the Institute for Health in Built Environments, like hospitals, at the University of Oregon, and co-author of a forthcoming paper on COVID-19 in the built environment, says that there is evidence that higher air humidity can reduce the viability and airborne transmission of coronaviruses, saying that a humidity of 40 to 60% might hinder COVID while avoiding the growth of mold. So that is, there's probably more, and there's probably more on the horizon, but these are 11 things that hospitals could be doing or are doing or have always been doing to prevent the spread of disease in its patients, visitors, and staff. And, diseases have always been around. The flu kills thousands of people every year. Pneumonia is an issue. Strep throat is an issue. Hospitals are always concerned about not transmitting disease. Oh my goodness. Hey, Kim, thanks so much for checking in. Thank you. So, I was surprised when this first started to really become, like a global emergency. And check out my posts on Instagram. I posted a small video from the Director General of the World Health Organization, who said the World Health Organization declared this COVID-19 situation a global emergency January 30th, when there were only 82 cases outside of China and no deaths outside of China. Hospitals have been worried about, spreading disease and preventing such spread long before that. And so, do not be alarmed. Of course, take your own precautions, wear the face mask, cloth, surgical mask, whatever you have, N95, whatever you have your sanitizer with you. My special thing is I have my own pen, because sometimes folks will take every precaution in the world, but they'll hold on to a strange pen to sign something, and you might catch it that way. So, and while you're going to these facilities, call ahead to see if you even need to go there. There might be an option for you to get your issue taken care of from the safety of your own home. Okay, so number one, just to sum up, number one is the hospitals will take calls from you before arrival to see if you even need to come. And if you do need to come, where you need to go. If you're interested in testing, there might be a testing site separate from that medical facility. So that's number one. Call ahead if you're thinking about going to the hospital. Number two, hospitals have personal protective equipment for you and the staff. At least a surgical mask for you, and then the staff has more to keep the staff from spreading it from patient to patient. Number three, separate entrances at the hospital, your primary care doctor's office, or a freestanding ER, separate entrances for people with symptoms concerning for COVID. Number four, once you get there, designated areas like an old building dedicated to respiratory virus evaluation, or a tented area where you could go, as they have in many of the testing stations. So that's number four. Number five is no touch methods of waste disposal. We've always tried to avoid touching your waste. So that's nothing new, but that's number five. Number six is routine cleaning and disinfection procedures appropriate for COVID-19, including patient care areas where aerosol generating procedures were performed, like nebulizer treatments for asthmatics, or nebulizer treatments for people with pneumonia and asthma, or maybe even COVID. So that's number six. Number seven is that elective surgeries have been stopped to limit the number of people in the building, to free up ventilators and ORs, and to free up staff. So elective surgeries have been put on hold. Number eight kind of goes with seven, just limiting the number of visitors in general. So if you're a family, friend, coworker, or someone, and you're taking them to the hospital, you might have to sit outside and wait for them to come out. So that's eight. Number, nine is the sanitizer dispensers. There should be more sanitizer stations at the entrances to any medical facility, be it an urgent care, freestanding ER, hospital-based ER, your primary care physician's office. There might be sanitizer dispensers on the wall, or even if they just have to have the bottle at the door. And there's also the possibility that there might be sanitizer dispensers right when you come in, by the patient rooms, and maybe even by the patient bed, so that the hospital staff can sanitize their hands right after patient care before touching anything else, to even lower the chances even further of them spreading the virus. Number 10 is bumping up ventilation rates. Hospitals can bump up ventilation rates to bring in more fresh air from outside, thus diluting the concentration of virus in the air. And number 11, which could be happening or may happen in the future per the University of Oregon, but humidifying the air to a sweet spot between 40 and 60% humidity could reduce the viability of the coronavirus and thus the airborne transmission of the virus while avoiding the growth of mold. So I hope that that was really, really helpful. I hope that that put you at ease and will make you feel better about getting any care that you might need, and also make you aware of options to going to the hospital, because you might not even have to go. So at least just call them and see if you need to go there anyway. And I know that was a lot, but that's how much the hospitals are doing to protect you so that you can get the care that you need and hopefully not walk out of there with COVID-19. So I'm Dr. Khadisha, your board certified emergency medicine physician and author of the best-selling book, Help Us Help You in the Emergency Room, which is really important right now, because if you are worried about spending more time in the hospital than you need to, my book of advice will help you to have a more efficient visit so that you're not waiting as long, maybe not getting as many tests. And my book also tells you to call your primary care doctor to see if you even need to go to the ER anyway. That's one tip that I'm giving away. So, and developer of the mobile MD kit. So you can check out the book at www.helpushelpyoubook.com and check out the kit at www.themobilemdkit.com, or you can go to my website. Do go to my website, drop off your email and your name so that you can get free 8 free essentials to surviving a medical emergency, and for weekly tips, because this week is World Vaccination Week, and I did write a blog on vaccinations that every adult should have and vaccinations that older adults should have, given that they are more vulnerable to this infection. And then, like little daily positive emails, and I might add an extra blog or 2 in there also. So follow me on all social media at Dr. Khadisha MD. That's DrKadishamD, like here on Facebook. On Instagram, it's Dr_Khadisha_MD. Also, check out my YouTube channel, which is RapMD TV, and you can check me out on Twitter also at Dr. Khadisha MD. And thank you so much. I hope this information helps. Please hit like, do comment, let me know of other topics that you might want to know about. This topic, today's live stream is dedicated to Jean Williams, who had messaged me directly and told me she's out in Atlantic City, New Jersey. And she told me that there is great concern, even out there. I'm in Houston, Texas. She's in Atlantic City. I'm seeing it on the news that people are afraid of going to the hospital. So that's why I did this live stream. Hopefully it'll help you and others. Hit share, do comment, hit like, and I will see you in the next video.